Hi everyone, good afternoon. My name is Norma Trinidad Diaz. I'm Assistant Workshop and Outreach Coordinator. We're very excited to have this Facebook Live. We're currently on Facebook and on YouTube. Thank you everyone for joining us today. And we have also our our partner organization today with us that I will let my coworker Ingrid share her information. But currently right now, I would like to let everyone know that we're very excited to have this Facebook Live. As you know, we have been sharing information on our Facebook page as well as YouTube, information about DACA recipients obtaining Cover California. And our Facebook Live have been in Spanish, but we would like to continue sharing the information in English to our English speakers on our Facebook page and YouTube. For those that are known of Civic is a nonprofit organization offering immigration services throughout the Central Valley, as well as information about health. And also, we have an entrepreneurship department with Civic. For those that are seeking more information about what Civic services provide, please follow us on Facebook, on YouTube, also on our website. We have information on, give me 1 second on this. We have information on services about immigration, health, and entrepreneurship. We have published the immigration workshops throughout our page. So welcome to follow that on vallecentral.org. For other details about other services that we offer, we also have a website in English on civic.org. And you guys are welcome to follow that out on our web page, and we're welcome to share that throughout our comment section. For our community, please share this information, this live to on your social media. And don't forget to provide us with the like. That way, we are able to continue providing this information throughout our Facebook, providing other services that can be beneficial to you and your family. So I will go ahead and pass it on to Ingrid to introduce herself and then to introduce our partner organization for today's Facebook Live. Go ahead, Ingrid.
Thank you, Norma, and thank you everyone who's tuning in. I see a few of you community members joining us for the Facebook Live, so thank you for that. My name's Ingrid Salazar. I'm the Health and Immigration Community Educator here at Civic. So I work alongside Norma to provide and inform all of you for subjects or topics, related to health. So today we have a very special guest who has joined us previously in the past few weeks to talk about a really important topic that will really benefit, especially if you are a DACA recipient tuning in, or you have a family member or know of someone who is a DACA recipient. This information will be very beneficial. So please go ahead and share it. Know that after the Facebook Live ends, it does stay on our Facebook page, so you can always refer back to this video for the resources. There will be contact information such as the website, the phone number to call for the information that we'll be talking about today. So you can refer back to it. It will also stay saved not only on our Facebook page, but our YouTube channel, because that's also where we're currently going live today. So just make sure to follow us on social media, as my coworker and colleague mentioned, Norma. You can follow us on Facebook, YouTube, and then also Instagram and Twitter, because we'll also be providing more information on today's topic as the weeks go by. But I'll stop talking now so that I can pass it over to our very special guest, Ana Alvarez, who's our presenter, who will be letting you all know about today's topic. Go ahead, Ana.
Thanks, Ingrid and Norma, and thanks for having me these past couple of weeks. My name is Ana Alvarez. I'm a campaign organizer with an organization called Health Access California. We're a statewide health consumer advocacy coalition, and we advocate for quality, affordable healthcare for everybody who lives here in California. And I'm here today to talk to you guys about some health coverage options for DACA recipients. There's been some changes this year So excited to give you guys an update on what those changes are. But we can go ahead and get started. Let me see if I can switch my screen here. I do want to start off by giving you guys a little bit of information on the Health for All campaign, just because this campaign has done a lot of work to remove barriers to healthcare for undocumented folks living here in California. So this campaign advocates for the removal of exclusions to our healthcare system so that everyone here in California can access quality, affordable healthcare regardless of their immigration status. And over the last 10 years, the Health for All campaign has had a heavy focus on expanding Medi-Cal to undocumented folks here in California. And we've been very successful with that. And now over 1 million undocumented Californians are now able to access Medi-Cal. And so that's super exciting. But we do know that there are still barriers, especially for those who don't meet the income requirements that Medi-Cal has. If you earn too much for Medi-Cal, then you're not able to enroll into that program. And so there's not a lot of good options for those who are undocumented. But today, hopefully, I share one other option for, it's more specifically for those who have DACA status. And hopefully the information is helpful, but just wanted to start off the presentation with a little bit of context around this campaign. I talked about the Health for All campaign, advocating for access to Medi-Cal for everybody, regardless of status. And I wanted to explain a little bit about what Medi-Cal is for those who might not be familiar with it. It's a no to low cost public health insurance that's run here in the state of California. It offers a variety of services to those who are enrolled. Anything from preventative services to emergency, hospitalization, mental health services, prescription drugs, like all of the things that somebody needs in order to have good quality healthcare. It's offered in Medi-Cal. I did mention previously that you have to meet the income requirements for Medi-Cal, and huge emphasis on that. It is an income-based program, so you need to make a certain income in order to qualify. And just to give you an example, a family of 4 would need to have the income of $43,000 or below in order to qualify for the Medi-Cal program. And then I just want to mention again that in the income eligibility requirement is like the one thing that you need to make sure that that's all sorted out in order to qualify. You don't have to have legal status. You can be you can be fully undocumented. You could have DACA. That doesn't prohibit you from being eligible for Medi-Cal. It's just the income requirement that they're very strict about. So that's a little bit about Medi-Cal. And then I wanted to talk a little bit about Cover California, and this will kind of be more of the focus of today's presentation because this is where the changes are happening. Cover California is a health insurance marketplace that the state of California established after the Affordable Care Act, or Obamacare, was passed. I'll use Affordable Care Act, ACA, Obamacare, and even Cover California interchangeably. Just I'm referring to the same thing. Obamacare, Affordable Care Act, ACA is just like the federal term for it. Here in California, it's Cover California. But in Cover California, think of it like a store that you can go to, shop for their products. The only product that they sell is health coverage. And Cover California is the only like health insurance marketplace where you can also get federal subsidies. These help you pay for your monthly premiums every month. And this is also the only place where you can get cost sharing assistance that the state of California helps to pay for. And cost sharing assistance helps folks pay for their out-of-pocket costs. So like deductibles, co-pays, things like that. Um, but although financial assistance is available, it will depend on your income. So if you're a bit of a higher earner and you're purchasing through Cover California, you would get less financial assistance. Whereas if you have a low to like moderate income, you might get a lot more financial assistance. It just depends kind of where your income is at. Um, but that's a little bit about Cover California, just like in general. But the new change that happened this year is that the Biden-Harris administration changed a federal rule that was excluding DACA recipients from being able to access Obamacare here in California, Cover California. And so this change that the Biden-Harris administration did allows DACA recipients to finally enroll into Obamacare or Cover California. Um, and what's really exciting about it is that DACA recipients are also able to benefit from the same financial help as those who have legal status and are purchasing through Cover California. So really exciting change. Um, and I did want to just add that currently Cover California is only accessible to those who have legal status and DACA status. Those who are like fully undocumented are currently not able to purchase through Cover California, but the Health for All Coalition is advocating to change this because we want to make sure that everybody who lives here in California has the same opportunities to access quality health insurance. So that is something that we're going to continue fighting for this next year. So if you're in that bucket where, you know, you're undocumented, you don't have DACA status, and you don't qualify for Medi-Cal because of your income, and you're still kind of looking for a health coverage option and you want to get involved in advocacy, I'll have my email at the very end of the presentation. Feel free to reach out to me if you have any questions about how to get involved or just to learn more about the campaign. I'm totally happy to connect with you on that. But just wanted to make this plug so that it's clear that right now Cover California is only accessible to those with legal status and those who have DACA. But because, you know, we have this new change where DACA recipients are able to enroll in Cover California, I did want to spend a bit of time explaining some things for those folks who are going to be potentially enrolling in the next couple of weeks. Some things about Cover California plans. These are some of the benefits that they cover. They're generally the same benefits that I described earlier that Medi-Cal covers. Things like laboratory, emergency, prescription drugs, mental health services, preventative care, maternity care, all of the things. And you can thank Obamacare for all of these because Obamacare really set the standard for what benefits health insurances need to offer people. So that's why Medi-Cal and Cover California have like almost identical. I don't know that there's any difference between the two as far as like benefits goes, but it's because Obamacare really set the standard there. What types of plans are offered in Cover California? I mentioned earlier that Cover California is kind of just like a store. You go in there, you shop for the brands that you like. And so they have these 12 different health insurances that they sell through Cover California. I will note that, like, I know there's some parts of California where, like, for example, there's no Kaiser. So that area might not have Kaiser available. For example, I grew up in Salinas. For the longest time, we never had access to Kaiser because the closest Kaiser was like an hour and a half away. So that was never an option. But I went back in Thanksgiving and I finally saw a Kaiser clinic. So maybe they're gonna start offering Kaiser in Salinas now. But just flagging that in your area, you might not have all of the options. It just depends on what your region has access to. One thing about Cover California plans is that there's tiers that you can choose from. So gonna go back one slide for just a second. just as an example, let's say I choose Blue California, this health insurance here. I would then have to choose a tier level for that Blue California plan. So they'll have bronze, silver, and gold. There is a platinum. I'm just not sure why it's not on their website, but I think platinum is also an option. But for these three plans, the bronze level is kind of like their lowest tier. Your monthly premiums are pretty low, but then your out-of-pocket costs are pretty high. It covers 60%. So just keep that in mind when you're, doing your homework on which health plan, which tier is going to be the best fit for you and your lifestyle, your family. Um, we do have the silver plan that has the also low monthly premiums, but the out-of-pocket costs are pretty moderate. It covers 70 to 94%. Uh, mm, the deductibles, I think, at this moment in time are, I think 0 right now. The copays are also pretty low. The premiums are low. So, uh, I don't wanna tell you guys what plan to choose, but I would definitely suggest you guys choose a silver plan because it is the best bang for your buck. Um, it's a low monthly premium, just like the bronze plan, but you pay less when you go to the doctor. So just keep that in mind. And then we do have the gold plans that have their monthly premiums are high, but when you go to the doctor and you use the coverage, you pay less. It covers about 80%. So just keep this in mind that regardless of which plan you are offered, whether it's Anthem, Blue California, Kaiser, HealthNet, you're gonna have to choose a tier, and make sure that you choose a tier that works best for you. Cover California also does sell vision and dental coverage for adults. They also offer it to children, but you'll learn a little bit about what the deal is with children in a little bit. So adults can purchase vision and dental separately. For kids, their coverage for dental is free, but an adult in their family has to purchase dental for themselves in order for the kids to get the dental for free. So for example, if me and my partner have a child and we're all going to purchase through Cover California, in order for the child to get free dental, either myself or my partner would need to purchase dental for ourselves in order for the children to qualify. Um, for vision, I don't think there is that same requirement that an adult has to purchase it in order for the kids to get it. I think the kids just get it, or the adult has to potentially enroll the child into vision. So keep that in mind when you're doing your homework on which plan you want to enroll for yourself, for your kids. And then how and when to enroll. Cover California, I think this is the number for help in English. You can call them with any questions, concerns about the program itself, how to enroll. If you want help in person, you can also ask them where to find somebody in your region that can help you do that in person. But you can also ask for this help online via their website, coveredca.com/support/contact-us. That's a long one, but this is their English website. And I will say explore the Cover California website. It has a lot of great information. It's really easy to use. One feature that I love so much about the Cover California website is their shop and compare tool, where you can input your information like your zip code, your income, your family size, all those kinds of things. And they'll kind of give you a short list of like what your options are, and how much they would cost you every month, what the coverage is going to look like, so that you can make an informed decision about what's going to actually work out for you and your situation. So highly suggest doing that before choosing a plan. And then for those who either have legal status or who have DACA right now, we're in the middle of open enrollment season. It happens every year, starts November 1st, ends July 31st. And yeah, we have a few weeks left before open enrollment ends. So do enroll if that is something that you're interested in. If you enroll in the month of December, your coverage will start January 1st. So just keep a note of that. But yeah, that's how and when you can enroll into Cover California. And then one question that we have been getting from DACA folks who are enrolling for the first time ever is which documents they need to submit in order to enroll into a Cover California plan. I listed two options here. It's either the notice of action that's issued by U.S. Citizenship and Immigration Services, and it shows that you have deferred action status, or you can submit the employment authorization document indicating that you have authorization to work in the United States. Those are two options for documents that you can submit. Cover California just needs to know that you have DACA status. That's why they ask for these documents. And they do give you 95 days to submit the forms. But although they do give you 95 days, if you need more time, you can ask for an extension, but you have to ask for it. You can't assume that they're gonna just automatically know you need it. I believe they give you 2 extensions that are 30 days each. So you have quite a bit of time to submit the forms, and they're willing to be lenient and give an extension. Um, and then one other thing that I wanted to touch base on is related to public charge. This is a really huge fear in the community for obvious reasons, and especially, during Trump, what we're calling Trump 2.0. He's going to be the president again, and that's very scary for a lot of reasons. But I did just want to give folks some reassurance that at this time, Medi-Cal is like, if you're applying for it, if you enroll in it, if you use your Medi-Cal, none of that counts as public charge. And same for DACA recipients who are enrolled in Cover California, using their Cover California plans, enrolling in the program, all that kind of stuff. None of that counts as public charge. So whether you qualify for Medi-Cal or whether you qualify for Cover California, please do sign up, use the coverage, take advantage of it, because it doesn't count as public charge. So just wanted to give that little bit of reassurance. And then some of you may have seen that this DACA expansion that I'm referring to has been in the national news because there was a court case that was submitted a few months, I want to say a few months ago, where 19 states tried to block the DACA expansion to Obamacare, and a few weeks ago, a judge granted them a block. So for just a little bit, there was a little bit of uncertainty in those 19 states. DACA recipients kind of had to pause on enrolling. But I got an email today saying that they granted, I think it's called a stay on that order. And so that kind of, at least for right now, reversed the block. So now, regardless of where you're living in the United States, if you have DACA, you're able to enroll in Obamacare. So yeah, we're gonna keep monitoring the situation, because obviously things are happening really fast. Like, I think a few weeks ago when I did the first English Facebook Live here with Civic, I think I had different news than I did today. So things are happening in real time. And we'll make sure to keep folks updated on any other changes. But as of right now, if you have DACA and you're living anywhere in the US, you can access Obamacare. But just to also make a note, since we're here in California, California was not one of the 19 states affected by that court case. So even if in that court case we had different news, California still would not be affected by it. Um, so just to make a note of that, um, we'll keep you guys updated on any other updates on this court case, or if anything comes down from Trump or Congress or whatever. There's changes that may happen. We'll keep you guys posted. But for right now, enroll, use your coverage. And yeah, I did want to leave you all with my email address. Like I said earlier, the Health for All campaign is going to keep advocating so that we can continue removing barriers to healthcare access here in California for our undocumented community. So if you are undocumented right now and don't qualify for Medi-Cal because of your income, you don't have DACA status, so you can't access Cover California, and you don't have any good options for or affordable options for coverage, and you want to get involved in advocacy, coming out to the Capitol or meeting your legislator locally, let us know. You can reach out to me for more information. We'd be happy to teach you all about what we're doing here and plug you in. And yeah, I think with that, I will hand it back to the civic team and see if there's any questions from you both or from anybody on the live right now.
Thank you, Anna, so much for today's presentation and for providing those updates, because I know the last Facebook Live, as you mentioned, there were different updates, there was different news. So it's really great that you're able to provide this, like you said, in real time. As the days go by, things are changing. We never know if anything is set in stone. So thank you for providing those updates. As of right now, we don't have any questions from the community, but I also do want to thank you for mentioning the fact that the community can reach out to you if they want to get involved in advocacy work and support the campaign and work alongside health access and with the Health for All Coalition. It's really important to get the community involved, right? Because without them, we're able to do it, but it's a much it's greater help to have the community involved because it's really, we do it for them. We do it for you all that are tuning into this live broadcast, whether it's in real time or later on after the live broadcast has ended. Civic has been supporting the Health for All campaign for a couple years now, and we're going to continue to do so. So if the community can join us, it would really be great so that we can get you all involved and really get the word out there, make it really known the importance of having health rights for everyone. I'm now going to pass it over to Norma if you want to add anything or if you wanted to ask any questions to Anna.
Thank you, Ingrid, also for Anna for your time to be present with us. There was a couple questions from our community asking about public charge. We want to continue to share that information with you, as well as Anna was able to explain. Does not affect in this process with Cover California for those that are obtaining coverage throughout that for DACA recipients. So please share that information. We ask that if you have any families or friends that are asking those questions, please direct them to us. We'll be happy to answer any questions related to that. But also we want to let them know that we have immigration workshops that you're welcome to come in, speak to an immigration attorney about your legal case, about public charge. You're getting the same information from us that public charge does not affect in this process that for DACA recipients are wanting to apply for Cover California. But if you feel more comfortable speaking to an immigration attorney, those are free of charge. And we want to let you know that that is available to you in the upcoming year in the 2025. So we want to go ahead and share that information with you all, that we have that service available to you. And we want to continue empowering our community about not stopping obtaining Medi-Cal if you're eligible. Speak to a nonprofit organization about your eligibility. As Ingrid mentioned, we don't offer those direct services for Medi-Cal and Cover California or in renewal of Medi-Cal, but we do have connections with partner organizations that do provide those services. So if you're a DACA recipient and wanting to apply and seeing if you're eligible for Medi-Cal or even for Cover California, as Anna mentioned in her presentation, welcome to reach us out. We have also posted on our comment section websites and phone numbers that you're welcome to reach out. Also, Anna has her information on the screen, so please take advantage of those information to reach out and ask your questions. Anna, thank you for your time. It was very well informed for our DACA recipients that are eligible to apply for California here in California and other states, as you mentioned. Thank you for those updates as well. We will continue to share the information throughout our social media. We do have a schedule to share a Spanish version of this presentation, so please look out for those information and sharing with your community. So any questions that you may have related to case, welcome to reach us out to support you on enrolling into Cover California or even wanting to apply for Medi-Cal. Thank you, Anna. Any other information you would like to share or any thoughts? Last final thoughts?
No, just thank you for inviting me once again. And hopefully I can come back next year with even better news on all of these expansions. But yeah, reach out to me if you want to get involved in the Health for All campaign. We'd be happy to have you. Thanks, y'all.
Thank you, everyone. We'll see you on the next slide.